And the topic for today is, what is chronic pain syndrome and do you have it? And I'm making this in response to one of my readers who always gives me these great questions. And she was looking through her chart. I guess she was reviewing her records and she saw this diagnosis of chronic pain syndrome. And she thought, wow, I never heard of that. What is that? And when she read about it, it's like, oh, wow, this is me. And it was very validating for her, basically, is what she said. That just like hearing that there's a name for this complex problem that none of her doctors have been able to solve for her. And that's so incredibly important because if you're also dealing with a persistent pain problem where you've seen a lot of professionals and different opinions, or someone saying we did all the studies, there's nothing wrong, blah blah blah, but you're suffering, or maybe you got someone who's identifying part of the problem and naming it, but it doesn't really speak to the whole of your experience. And that's a classic thing for chronic pain syndrome. So let's unpack that a little bit. And what I want to say, first of all, is that the diagnosis of anything in medicine is just a way of hanging a name on something. And it's incredibly important and it's useful for a lot of reasons, but we shouldn't limit ourselves to what the diagnosis says, because most people are more rich and complex than the diagnosis. So I'm going to talk a little bit about the diagnosis, but then I'm going to talk about the experience. Having seen probably 1,000 more people with chronic pain syndrome in my career, I want to speak a bit about really the four things, like what are you experiencing? Like, not what's it called, but what is your experience? What's happening in your body, in your mind, in your world? And then the next question is, what causes it? Like, what made it happen? And then the third thing, which is slightly different, is what makes it worse and what keeps it going. Because especially with chronic pain syndrome, those are two separate things. So you really got to make that distinction between what triggered or caused it and where you are now and what's going on in your body. And that's what perpetuates the problem. And then the following question is, what can you do about it? And what you can do about it, and I'll get more into this, is more dependent on what is your current state of your biology, and what caused it is often less relevant, although you need to consider that too. Okay, so let's just dive into this. This is going to be a overview. This is like a little Facebook Live. I'm aiming for 5 minutes, so probably be more. But the point is, each part of this, each of those four questions could be like several talks. So I'm going to keep trying to talk about this stuff and share what I know, having worked in this field for decades. And I encourage you to ask me questions. If you're comfortable, put them in the comments. Bring your comments. How does this fit with you? Does it describe your experience? What was easy, hard? What helped you? What didn't help you? That stuff's really important to know. And then the other thing is, if it's not comfortable to put it out there on Facebook, you can always send me a PM. And so I do this a lot. Like, someone sends me a PM with a great question, and then I'll put it out as a video so that other people can benefit from that question. So bring it on, bring on your comments. So let's talk about chronic pain syndrome. Syndrome means we don't really fully understand it. Like anything called syndrome, there's so many syndromes, and syndrome means it's a collection of symptoms, and there's something we understand, some things we don't. When we call it a syndrome, it means we identify in lots of people some cluster of overlapping symptoms enough that we can say, here's a syndrome, and here are the criteria, or here are the identifying qualities. So chronic pain syndrome, what are the identifying qualities? What does a doctor look for when giving that diagnosis? First of all, it's persistence of pain. And chronic pain tends to be diagnosed as pain that's going on for more than 3 months. Some people would say more than 6 months. But chronic pain and chronic pain syndrome are a slightly different thing, because syndrome means it's a broader issue. That chronic pain syndrome is the pain is persisting, but frequently there's other things going on. Some of the other things that can be going on include loss of function. A person can be on their way towards getting less able to do what they care about, heading towards disability. Syndrome of chronic pain can include what you might call psychosocial or emotional dysfunction. And this is not just like, oh, you're bummed out because you hurt, so you're upset. it's a deep physiologic process we'll talk about in a minute. The point is that your biology changes when there's pain all the time. That pain information going into your nervous system changes stuff. It changes your biology of pain processing. It changes your inflammatory physiology, your immune system. It can shift your hormonal systems. And yes, it can shift your thoughts and emotions because it sucks to have pain all the time. It's really hard when you're trying to live your life and it hurts to do stuff. So there's a whole lot of social, psychological, emotional dysfunction that goes on with it. Feeling crummy, breaking down of relationships, being less interested in doing stuff that you care about, losing your roles in the world. Like if you can't go to work or you can't do the stuff you're used to doing as a caregiver or whatever it is that you're used to being and doing in the world. And then the thing, and those are the things that tend to be talked about in mainstream conventional medicine about chronic pain syndrome because they're identified and they're named and quantified and but there's this other part that in the world of functional medicine we think about, which is the more broader biological dysfunction that goes on. So the part of biological dysfunction that is described typically in chronic pain syndrome is changes in pain processing. We know your pain system is not just like the nerve coming from your hand where there's something burning you, but the actual processing the signal in your spinal cord and various parts of your brain before it gets to the part of your brain that says, my hand is burning, and then the other part that gets to your brain that says, ah, because there's two parts to pain. Part of pain is that identifying the sensation and its quality, its location, its intensity. It's kind of an intellectual descriptive thing. But then there's this other part of pain, which is the emotional thing, which can be, depending on your culture and your background and your discipline, it could be like stoic, okay, it hurts, or it could be a full-blown angst and frustration and fear and anxiety, anger, rage, depression. Like there can be a lot that goes on depending on who you are and what's been going on. And just to be clear, like, that is not an issue of strength of character or anything that is worthy of judgment. Like there is no shame. Drop the shame and blame, please. I've seen so many people that part of the obstacle to healing is the shame and blame about what's going on. And what we have to just accept is that life is complicated, life is difficult. Hard, bad things happen that we don't completely understand. Most of us are not trained to deal with severe hardship. Most of us grow up in cultures where it's like everything's supposed to be good, and if it's not good, take a pill. And like, what if the pills don't work? And so a lot of people fall into this hole of distress and despair. I sat with someone yesterday, a lovely person who's in her 20s. She had a well-controlled kind of autoimmune disorder for decades, and then suddenly was been having back pain for a while, and suddenly got diagnosed with inflammatory arthritis from this autoimmune disease, or associated with it, I guess we call it. And the distress in her was we just talked for a few minutes, and it's like tears and tears and just so much pain. It's so hard. Okay, so that's like what it is. Like, what is chronic pain syndrome? And the part that I want to just speak to is that the change in your physiology that gets identified in conventional circles of worsening pain and worsening pain sensitivity is just the tip of the iceberg, because there's a whole set of changes that we think about from an integrative functional point of view that have to do with things like inflammatory signaling and hormonal function, and the way that the loss of sleep, which often happens with chronic pain, affects so much of your biology. The way it affects things like your metabolism and your glucose control. The way it affects things like muscle function and your ability to actually contract your muscles. And one of the most important things is cellular energy, which has to do with the way your cells produce energy. And all of these things I've just mentioned interact with each other in kind of a snowball-like vicious cycle. And for many people, when that pain persists, and then you get that distress signal from the pain, the emotional frustration of the pain, the loss of function, the loss of whatever it is, the frustration about losing functional ability, loss of sleep, like I said, that just drives that whole system. So you get all these biological changes along with all these autonomic changes when your fight, flight, freeze response gets stuck in the on position or overrides your rest and digest relaxation response. And that drives this snowball. So chronic pain syndrome can be a lot of different things. It's a very general term. Some people have various subcategories of that. Fibromyalgia is a chronic pain syndrome. Chronic myofascial pain is a chronic pain syndrome. Chronic widespread osteoarthritis or pain from rheumatoid arthritis or other inflammatory arthritis. Chronic pain syndrome. Neuropathy that's chronic. Chronic regional pain syndrome. These are all different kinds of chronic pain syndrome. And so, what diagnosis should it say on your chart? Should it be the specific one, the more general one? There's a lot of variability in that depending on the doctor you talk to, depending on what's on the little cheat sheet that has the numbers. The medical record is this monster. You have to put a number into it. You have to put a name into it. Like I look at my medical record at work and I write chronic pain and 17 things come up. So it's like, which one do you choose? And a lot of them overlap. So I encourage you not to get caught up in like, well, which chronic pain syndrome do I have? Because there's so much overlap. And that brings us to the next part about like, well, what caused it? And then what's driving it, right? Because a lot of things can generate or trigger chronic pain syndrome. Part of that depends on what else has been going on in your life. What are your genetics? What's your early life experience? To what degree have you lived with a chronic hyperactive, hypervigilant stress protective response because of early childhood experiences, previous injuries, previous illnesses, et cetera, et cetera. These are things that a really good doc is going to ascertain and clarify because it's going to help him and you understand, well, what do I do about it, right? But the trigger could be a lot of different things. Fibromyalgia is a great example, and it highlights kind of the confusion out there in the medical world because is fibromyalgia caused by a neck injury? Is fibromyalgia caused by trauma? Is fibromyalgia caused by stress? There's all these, is it caused by, as if there's one thing that causes it. But let's get back to this notion that there's a wheel of different physiological processes that drive the development of chronic pain syndrome and all the associated symptoms. And there's a lot of things that can pop that wheel and get it spinning. And it can be a trauma. It can be a neck injury. It can be a horrible gastrointestinal illness or viral illness. A lot of people come to me after a viral illness, after COVID. There's a subset of people with post-COVID pain syndrome who have what looks like fibromyalgia. So what is it? Is it post-COVID? Is it fibromyalgia? I talked about this in another video. The point is, it's a syndrome where there's a bunch of physiologic changes in the biology, and whatever triggered it, what brought it on, whether it's a post-viral syndrome or a post-traumatic syndrome or an autoimmune syndrome or a stress-related syndrome, those are triggers. And then you get this spiral of underlying physiology that drives the symptoms, whether they be the symptoms in your brain, like brain fog, confusion, pain, anxiety, depression. I'm saying in your brain because we usually think about it. I actually think of these symptoms as systemic because they're related to systemic biological changes. But those are brain-like things. You might see a psychiatrist or a neurologist. What you really also need to do is see someone who's looking at the whole picture of what's driving those symptoms. And then you could look at your muscles and bones and joints and call it a pain syndrome. And there might be a rheumatologist or orthopedic surgeon who you're seeing, and if they're focusing on your knee or your back or your whatever, when what's going on is this whole spiral of underlying issues, then they're missing the big picture. Someone's got to hold the big picture. I encourage you to start thinking about it that way. What is the big picture of the underlying biology? You got to start figuring that stuff out because that is what determines what you do about it. Because you could have really bad arthritis in your knees, or you could have developed a spinal cord injury, God forbid, or some other thing that triggered a whole thing, and you might be still dealing with the effects of that. You might have peripheral neuropathy or CRPS or something like that, where there's still ongoing pain generation, and that might be your diagnosis that you have that peripheral neuropathy, CRPS, traumatic brain injury, spinal cord injury, chronic arthritis, rheumatoid arthritis, whatever it is. But if you lose the forest for the trees, then your outcome is not going to be as good. So stay in touch with all those things that might be going on. Because let's say, for instance, there was a neuropathic injury from cancer chemotherapy, for diabetes, for who knows what, but you've got an inflammatory thing going on in your body, and you're not sleeping. Your hormones are out of whack. You're dealing with depression and anxiety. You're dealing with soft tissue problems or neuromuscular changes from chronic muscle spasm and guarding and protection. This is why I talk about the 6 things that worsen pain and prevent you from healing. I got a whole video series on that. You might want to check that out. I'll put a link to it somewhere, maybe in the comments of this video. But the point is, identifying those things that are perpetuating the problem, in my experience, is frequently what lets people actually have an impact on it and get better. And frequently when people come to me and they're dealing with that diagnosis, please see the patient about peripheral neuropathy. And the neurologist has been treating them with Lyrica and Cymbalta and all the different Tegretol, all the neuropathic pain agents, but they're not getting better. Well, what else is going on? Oh, they're not sleeping. Oh, they have post-traumatic stress disorder. Oh, they've got a chronic low-grade inflammatory. Oh, they've got leaky gut and dysbiosis, and they're really deficient in vitamin B12 and magnesium and iron because their system's not absorbing stuff, so their body can't heal, so on and so on. So that's an overview. Tune in for more. I encourage you to follow my Facebook page and get on my email community if you want to learn more about all this kind of stuff, because this is my life's work and I'm here to help you learn how to cope and deal and live better despite all this difficult stuff. So thanks for watching. Share this with your friends and come on back for more. And most important, leave your questions in the comments or your comments in the comments. Thanks a lot. I'm Dr. Schiller.